Prevention of bronchitis due to medical cannabis. One of the methods of consuming medical cannabis is via the cannabinoid therapy, which is my main topic as it is my specialization and my work as a practiced orthopedagogue. The cannabinoid therapy is done primarily through the inhalation method. Inhalation can be done in two ways. One, smoking, two, vaporizing. When it comes to vaporizing medical cannabis, all clinical research agrees that there is no risk
of the lungs. In other words, vaporizing medical cannabis is recommended during the cannabinoid therapy. When it comes to smoking medical cannabis, the subject needs to be explained in much more detail, which I would like to share with you. First of all, there is the question you can ask yourself: why smoke medical cannabis when you can vaporize medical cannabis, knowing that vaporizing is considered safe for the lungs? Note that the cannabinoid therapy uses the vaporization method during the session with the patient. The subject of smoking is explained purely for information, for educational purposes. The topic of smoking medical cannabis is explained in order to better understand the topic and draw the necessary conclusions. It goes without saying that this topic is not there to incite a patient to smoke instead of vaporizing, but to teach health prevention regarding medical cannabis. Here is a picture of a resident named Moshe Rute at the Hadarim nursing home in Kibbutz Na'an, Israel. Under the supervision of the head nurse Inbal Sikorin, the patient smokes his medical cannabis prescribed by the doctor of the nursing home. Here we are talking about smoking and not vaporizing. At the nursing home, other residents consume medical cannabis via vaporization. Perhaps the reason Moshe Rute smokes and does not vaporize his cannabis is because he is very old, 80 years old, and he is past his age of learning a new way to use his medicine, or just that he prefers it this way for convenience or some other reason. In other words, in the nursing home, the administration method is a little more relaxed because there are people almost at the end of their life. They deserve their dignity. Before I mention prevention of bronchitis due to cannabis, as the title says, I would like to share with you a few mentions of Dr. Donald TASHKIN, pulmonologist in Los Angeles. In a lecture by the association Patients Out of Time, Dr. Donald TASHKIN mentions in a YouTube video titled Smoked Cannabis Effects on Lungs, Part 1, Dr. Donald TASHKIN. There are differences between marijuana and tobacco. Marijuana contains a number of constituents not found in tobacco that might have countervailing effects. Indeed, like tobacco, cannabis contains tar and carbon monoxide, but cannabis, medical of course, because the quality of cannabis influences the quality of the constitutions, contains a number of constitutions like CBD, CBN, CBG, CBV, but especially THC. THC and other cannabinoids have a countervailing compensating effect as they have an anti-inflammatory effect, which tobacco does not have, and so cannabis will not be harmful to the health of the lungs like tobacco is. In the clinical trials that Dr. Donald TASHKIN supervised, these are patients who have smoked 3 joints per day and have been doing so for 15 years. So you won't see more extreme in the tests. He concluded in these tests that less than 40% of the subjects had problems with acute or chronic bronchitis, so less than half of the subjects. In other words, when someone smokes medical cannabis, they are more likely not to have a cough and breathing problems than the opposite. This is important to know for both the prescribing physician and the patient in order to determine the correct benefit-risk ratio of medical cannabis for a certain patient's pathology. We can already deduce and make 2 conclusions regarding the prevention of bronchitis due to cannabis. The first is to favor vaporization. The second being not to mix inhalation of cannabis with tobacco. Inhalation is done with cannabis only. So pure cannabis flower and nothing else added, not even cannabis leaves. In the second part of the video, Dr. Donald TASHKIN mentions, so I would conclude that the findings do not support the concept that habitual marijuana smoking leads to COPD. In order to show you the benefits of the cannabinoids as mentioned before, I am sharing these words with you from the pulmonologist. Thanks to the interaction of cannabinoids, also known as the entourage effect, serious lung diseases such as COPD, chronic obstructive pulmonary disease, do not occur after smoking medical cannabis, and this as opposed to smoking tobacco. This is not to darken the image of tobacco, but to accentuate the compensatory and thus protective, in our case, effects of cannabinoids. And finally, in the third part of the video, Dr. Donald TASHKIN mentions, we did not observe a positive association of marijuana use, even long-term use, with either lung or UAT cancer. So, as much as smoking tobacco carries a high risk of lung cancer and upper aerodigestive tract cancer, smoking medical cannabis does not carry this risk. Nevertheless, and especially there is still a risk of acute or chronic bronchitis, it is important to know ways of prevention, mainly for the lungs, throat, and sinuses. Number 1, food and drink. Avoid eating and drinking too much glucose. This sugar, which will partially remain in the throat, is a nest of bacteria which you do not want to accumulate. Avoid drinking too much milk of animal origin, such as cows or goats. These drinks, which contain the protein A1 casein, which can build up mucus in the airways. Number 2, during the cannabinoid therapy, it is advisable, and especially when the cannabis is not of superior quality and therefore harsh to the throat, to consume some raw honey and oregano essential oil and or blue cheese. These natural products are antibacterial, which helps medical cannabis to act as an antibacterial substance as well. It is also important to drink plenty of water. Number 3, wash the sinuses with the Ayurvedic method, the Neti pot. Here is a picture of the Neti pot. To this, add lukewarm water with either a drop of apple cider vinegar or grapefruit essential oil, or a pinch of good quality salt like pink Himalayan salt. Number 4, steam fumigate with eucalyptus essential oil, peppermint, lavender, or other essential oil suitable for the respiratory tract. Number 5, massage your nose and sinuses frequently with your fingers or with the help of a Jane stone roller. Here is a picture of the massage locations. And here is another picture of a jade stone roller. Number 6, drink grogs with cinnamon, fresh garlic, lemon, cloves, pepper, turmeric, and a mixture of hot green tea and spearmint tea. Number 7, avoid drinking alcohol, even a glass of beer, while consuming cannabis. Alcohol and cannabis do not mix. This mixture is not good for the mental and physical health, including the respiratory tract. And to conclude this topic, I would like to mention that during the cannabinoid therapy, while inhaling medical cannabis, it is not uncommon for the patient to cough. This cough may indicate a positive result from the cannabinoid therapy because medical cannabis is an expectorant. Expectorating is a natural way to remove toxins, excess mucus from the airways. This is one of the reasons why a basin adherent is important during the cannabinoid therapy. The sputum of the phlegm can be deposited there by the patient. The practice orthopedagogue will be able to distinguish between an expectorant cough and a cough with doubt of bronchitis via the strength, duration, and sound of the cough. From the moment there is a doubt of bronchitis, The practiced orthopedagogue has the deontological duty to refer the patient to his attending physician.